Hey, this is Brandon with ChiroUp. I'm doing a quick interview with Dr. Craig Riverman. He is actually very close to where I practice. He's in Breeze, Illinois. I've been in practice for about 19 years. And a cool thing about Dr. Riverman is that he has the most condition reports created within the entire ChiroUp network. So I thought it'd be kind of interesting to figure out, one, how he's doing it, and two, why is he doing it? So Craig, thanks for joining me on this call.
Well, thanks for inviting me.
So realistically, out of everybody in the entire world, you have the most condition reports created. So the first thing I need to know is, who do you prescribe condition reports to?
Pretty much every patient, whether they're an existing patient, a new patient. I think an educated patient to me is the most compliant patient. So we pretty much prescribe a condition report to most every patient. So.
And so prescribing so many condition reports to get the amount of that, you have a busy practice, and I know you personally, and I know you run a busy practice. How do you get these reports to the patients? Is this something you're doing, or is it something your staff is doing?
Primarily myself and my associate doctor, Dr. Isaac. Essentially, what we do, we practice, I guess, a little bit different. I have a scribe in the room with me, so when I'm doing an examination on the patient, when I'm palpating and giving my objective findings, the scribe is in the room with me, and they're typing all this in. They're putting all the objective information in, and then when I finish treatment with the patient, and they're going to take the patient up to the front desk to schedule, I sit down at the computer and I review all the objective findings. I basically make sure they got everything in there correctly. And if it's a patient that I'm prescribing exercises to, if they're on therapy at the time, if we put them on therapy after I adjust them, or if I, say they don't do therapy, while they're going up front getting scheduled, I generate their condition report in the room. So I print it at the front desk and I email it to them. So they get an email and a printed copy. And we take the printed copy, scan it into their notes, into their patient file, and we keep a copy in there at all times so that the next visit when they come in, the CA that brings them back, that is the scribe in the room, starts getting their information. They go over the exercises with them and make sure that the patient has received them, if they have any questions about any of them. And then when I come into the room, I can review any questions they may have had with the exercises or condition. So.
So, what's the greatest benefit? And I'm going to separate that. What's the greatest benefit to you by using a condition report?
Time savings, hands down. That is it, it saves time for me. I said earlier, an educated patient to me is the most compliant patient. They're going to follow your treatment. I still need to educate them. I still need to reinforce what is in the condition report. Need to reinforce. To me, it's all about connecting with the patient. If it's a patient, I look at their occupation, I look at their hobbies, I look at what they do, and I try to liken their their care plan to, I'll use analogies very frequently to what they have going on. For instance, a landscaper or someone who does lawn maintenance. I talk with them about, okay, this is how you manage the turf. This is how you correct a problem. This is how you maintain a problem. This is how you prevent a problem from coming back. You know, this is the same way. We take them through the stages of their care. We're going to correct your problem here. Here's how you're going to prevent, keep restore functional biomechanics by doing these exercises. And here's how you're going to keep it from coming back by continuing with these exercises. So, and pretty much any occupation, I'm going to try to find an analogy to try to relate to them the importance of the exercise. I want that patient to get that aha moment, like, this makes sense to me. I get it. I understand why I'm doing these exercises. So.
And so that was really the second question. So the second question would be focused on the patient. What is the greatest benefit to the patient? Is it so they can understand their condition more? Is it so they have access to that information when they're at home? What do you think is the greatest benefit to using a condition report for the patient?
Really a combination of both. I mean, definitely access 24/7 is huge, because if the patient has that information at hand, they can look at it at any time. They may be busy during the day, they can look at it in the evening. If they're busy in the evening, they can look at it during the day. They can, but I'm here to reassure them, when they come in for their appointments here, their visits here, I can go over those exercises with them if they have questions about it. Like I said, the key to me is time savings. And I'm the kind of guy, you ask me for the time, I'll tell you how to build a watch. I'm going to be very thorough going through every detail with them. And ChiroUp does a very good job. The condition reports do a very good job at explaining the condition, but also how we're going to get this fixed through the treatment that we administer here in office and what they need to do at home. And I tell every patient that, it's a relationship. If you don't do your part at home, you're not going to get better. If we don't do our part here, you're not going to get better. We have to work at this together. And that's pretty much, patients really seem to love it. They love the access to it. They love the information they get from it. It's not that I still don't, show them things here at the office. It's not that we don't give them exercises to do more specifically. I do a lot of in-office rehab as well, but I tell them how, essentially when we're treating them here, our job is to kind of get them out of the gutter and get them functional again. And once things are functioning, here's also your way to build strength and stability to prevent this condition from reoccurring. So.
Excellent. Thank you for sharing all that. I'm going to go off topic. I only gave you 4 questions, but I always ask 5. So I didn't give you this one in advance. But I really find that this is one of the more telling questions and answers. So if you have a patient who's not willing to do what you ask of them, they're not willing to do your exercises, they're not willing to sleep on a different side, they're not willing to bend differently to get rid of their problem, what do you do with that kind of a patient?
Whew, put me on the spot. Actually, that is typically more of a challenging patient. And I'm going to go back and show my age here. If you remember an old movie, Days of Thunder.
Oh, yeah.
Okay, Days of Thunder. Do you remember when the mechanic, Harry, told the driver, Tom Cruise, drive 50 laps your way and drive 50 laps my way? Mm-hmm. And he goes, at the end of your 50 laps, you're going to burn your tires. At the end of my 50 laps, your tires are going to be fine. Some patients are very good and compliant about doing their exercises. The ones that aren't compliant, I'm going to tell them, you're not going to get better if you don't do the things that you're supposed to do at home, in addition to do what I'm doing in the office. I'm going to do my part in the office, but I can't do your part at home. And that's, so I'll use that analogy quite frequently. For my younger patients, they're not going to know what that movie is. They're not going to remember that movie, or, some that haven't seen it, but I do. I tell them it's a marriage. If you don't do your part, you're not going to get better. And some have to learn the hard way, and that's another thing we do. We reevaluate our patients as we are progressing through care. If at their progress reeval, they're subjectively not improving, or subjectively they say they are, but objectively I'm not noticing a ton of improvement, I'm going to have them show me your exercises. If they can't show me their exercises, I know they're not doing them. If they can show me their exercises, we might have to tweak it a little bit. We might have to change up what we're doing in our, but that's the whole idea of doing a progress reeval, is to make sure they're truly progressing. If they are not, we make tweaks in their treatment plan. If they are, okay, here's how we set the stage, and I tell patients that early on, we're going to do more to help you, and you're going to need to do some on your own, but we're going to transition into where you're doing more of the work and we're doing less of the work, so that we can graduate you into self-management. So.
Those are really great points, and I think that to piggyback that's exactly how I practice. As rehab is just showing a patient what they can do now, to show them what life skills they can accomplish by themselves and not need us as much. I really love the educated patient as a compliant patient. I think that one thing that as practitioners grow in their practice, they realize how important educating a patient really is, and educating them in their own words, not educating them with, there's 3 normal tires, a 1 ball tire, and something goes out of a line. You really need to use your own verbiage. So I highly recommend people customize their own accounts and customize the verbiage in those reports, because that's what builds that relationship and that rapport that is so important to build. The thing that chiropractors have the biggest difficulty with, which is compliance, is making sure people are following our directions so we can manage them conservatively. So thank you for chewing up some of your time on this Friday afternoon. Absolutely. I really appreciate it, Craig. Thank you for everything you do. One, for us at ChiroUp, you've given us a lot of invaluable information. Thank you for the service you provide as far as being a provider. And also, one thing that I think goes unrecognized sometimes is serving on your board, your state board. That a lot of people complain about their state boards or complain about their profession. But one thing I know about you is you're out for the right reasons, and you're doing everything right to make sure that your patients get the best care possible. So thank you for joining me on this call.
My pleasure. Thank you, Brandon.